When I went to college, I really wanted to be a politician. And my dad didn't think I'd make a good lawyer or politician because I was too honest. It's not that you get to fix everything. It's not that you always get the outcome you want. Some of it was figuring out that I didn't get to want it more than the person in front of me.
Welcome to Push Yourself podcast, where we explore real stories behind how people grow, adapt, and rebuild. My guest today is Dr. Sam Lookatch, a board-certified clinical psychologist specializing in addiction, trauma, and co-occurring mental health conditions. Sam has worked across the full continuum of care, detox units, residential treatment, academic hospitals, and now runs her own practice, Anchor Point Psychological Services. She also recently became a mom and building a career that prioritizes both meaningful clinical work and presence at home. Sam, thank you for joining. I'd love to begin with the way we always do, with a tiny bit of a caveat. So let's say you're speaking to a group of high school students. If you couldn't use the words psychologist, therapy, or healing, how would you describe what you actually do?
That is a very interesting question. Okay, so I can't use psychologist, therapy, or healing. Okay, so I would say that my job is one that provides me the privilege to learn about people, about their individual histories, their past, provide the space for them to feel like they're seen and their story is witnessed in a unique way where I'm not interjecting or sharing my own experiences or thoughts necessarily about how I relate to that, and more really giving them the space to understand, organize their thoughts and emotions around whatever it is that comes up for them so that they can get to a place where they feel um, less emotionally kind of triggered or evocative around some of those lived experiences that they may have.
Thank you. Thank you for taking on that challenge. This is the way I like to begin, just to go beyond the titles, of course. When we meet somebody, I think naturally the cliche question is what you do, and we tend to
Mhm.
go with just the title, whatever that may be. But I like to go a little bit deeper, and this is why we're here today, just
Yeah.
to present that challenge, but not a trick question. So,
Yeah.
what does your day-to-day look like right now, as both as a private practice clinician and a parent?
Yeah. So it's interesting. I've been in private practice now for I guess 5 months. And I'm still kind of carving some of that out and figuring out what that looks like exactly. But my split right now for the work week is that I'm working 2 days and have childcare for those days. And then the other 3 days, I'm trying not to work. And to be perfectly honest, I'm still very much like sending emails during my daughter's naps or when she goes to sleep. I have a peer supervision group that I still meet with from my last employment, some amazing colleagues that I've kept in touch with, and have that scheduled during my daughter's nap time on a day that I don't have childcare. So it's an interesting balance, definitely really tricky for sure. But my work days, um, when I was working in larger hospitals, you're trying to see a lot of patients, but you also have a lot of other stuff that you're doing around collaborating with other clinicians. Responding to a lot of emails. There's always a lot of emails, and that was something shifting to private practice. You don't necessarily have that on your plate anymore, but something that you do have that you don't generally have as part of your job when you're in a larger institution is that you're building your professional network, you're meeting people, you're trying to create referral networks, and you don't do that normally. You're kind of operating under the name of the system that you're in. So that's been, I'd say, like one of the greater challenges, and takes up a lot more time than I realized. I'm finding myself trying to schedule, 1 to 2 like coffee chats every week where I'm connecting with other clinicians and trying to build that network, while also making sure that I'm carving out space to see my clients and prepare for those sessions in a way that also continues to feel really meaningful and helps me maintain my skill set too.
Got it. You mentioned that you hadn't realized how difficult this would be? And I'm sure as much as we can try to prepare for something for the first time, doing something actually from theory, from research, from planning into practice, you hit on these things that come up that you didn't plan for. So can you share what some of these things that you maybe potentially try to anticipate for, but came out of nowhere now with this private practice?
Yeah, of course. So, even just like getting your private practice up and running, I know a lot of people do this when they're still like within a larger institution. And I had tried to kind of start getting the ball rolling, but for me, I had moved states. So I needed to get a license now in the new state that I lived in. I had two licenses in other states, and um, something they don't tell you is when you are licensed, it's actually a little bit more challenging to get licensed in another state because the you need the states that you are licensed in to complete paperwork for the new board. So for me, that was a big delay. One state just wasn't completing the paperwork that I needed them to complete to be able to gain my new license. I reside in the state of Illinois. So that took actually several months and phone calls, and there's usually not a centralized person. So that was a really big headache. And held up the formation of my LLC as well because I needed to have the license to create a business in the state in which I'm providing a licensed service. So that was something that I you can't really foresee that stuff. You just don't know if a board, how they're going to drag their feet or not. So that was a huge headache. And then yeah, once I got set up, I've just run into some other stuff that is maybe unique, but also not that unique. In the world of mental health, I accept very limited insurances, and this is part of the reason why I got boarded and credentialed with an insurance. And there was two systems that were supposed to be talking to each other. One had me, the other one didn't, and I spent 2 months calling each week to these call centers. And a little hack someone told me was actually reach out to the company on social media. So I did, and that's how I finally got the issue resolved.
Yeah, whichever avenue works. Thank you so much going in depth. Actually, what you have done is dispelled in a way a myth that I've heard for a long time. I've heard people tell me, like family members, oh, if you are going to go into the field of medicine, you become licensed in the state of New York, all the other states automatically accept that license, that it's so prestigious. Not to say it's not. I would like to think, being a resident of New York, but it sounds like this wasn't the case, most definitely, and that wasn't easy. I want to go back just a little bit. You said you have been in private practice for 5 months, and I'm sure
Mhm.
there have to be reasons, and I'm sure one of these reasons is birth of your daughter. Being a parent myself, my son is about 13 years old. So I understand in the beginning you have a lot of course, sleepless nights that with time, I see now you forget, they were there, but you forget how bad it felt to be underslept for months on end. How has your motherhood changed now? How do you look to show up for clients, for
Mhm.
yourself, and for your family now that you're in private practice?
Yeah, that's a great question. So, like for me, something that I had actually worked for the last like 8 years prior to the birth of my daughter, I worked condensed or compressed schedule. So I always worked like 4 days a week, longer days, like 12-hour days, or I worked on a Saturday for a few years. And then more recently in my last position, I actually was working 410. So I was working Monday through Thursday, but until 8 p.m. And I knew that that was something I was going to want to change. We were fortunate when we had our daughter, we were living in New York. So I had 3 months paid leave. My husband, actually, through his employer, had 4 months paid leave. So one of us was always home for the first 6 months with her, which was really lovely. And then when my husband was going back to work, um, we knew it was going to be short term, but I was like, oh, I shifted my work schedule to 5 days a week with only 2 nights and then one short day. So it was, we had nanny for a few days a week, and we had, thankfully, my mother close. So she provided childcare for 2 days a week for like my shorter day, and then one longer day. But it was like, okay, I don't want to do this work schedule anymore. I'm missing like all these days with my daughter. As soon as I get done working, we're putting her to bed immediately. Um, and I should say, I guess one of the interesting things that was kind of helpful was when we moved, we relocated. I was still working remote and still do work remote, and see clients on the East Coast. And I'm in a central time zone now. So I could work till 8 o'clock, but it would only be 7 o'clock in the Midwest. And then was able to at least be a part of bedtime. But that was also a huge impetus for this. It was like, okay, well, I don't want to be losing 2 hours a day to commuting to a new hospital. And I want to be able to make sure that I can be around for these things for my daughter. She's only young for so long. She's only going to want me to rock her to sleep for so long. And I wanted to make sure that I wasn't missing that. Something I didn't necessarily expect on the flip side of stepping down to part time and seeing significantly fewer clients. Right now, I'm not running groups. That is something I hope to get back into. But I um, didn't think about how much I'd actually miss the work as well. I've been doing this for so long at this point, and like you get caught up in like the work week scramble and think like, oh, I'm so ready for a change, and then that change comes, and you're like, I I don't want to like get rusty on this stuff. I miss like being able to work with some of the clients. Like for me, I've worked with some patients for years and not being able to like take all those clients with me to private practice, it feels like a loss. And you wonder as a psychologist, sometimes you wonder like, how is that person doing? And it's the unique thing about the work we do is like you don't always get to know. And actually most times you don't get to know. So it's kind of one of those when you terminate with someone you wish them the best and you do hope that you don't see them again because it means then obviously they're having something happen that they need the support and, no shame in that, of course, and, at the same time, you lose that relationship and, it's a unique relationship and you really grow to care for that person, and I think becoming a mom, if anything, that's underscored that care and connection that I do have for the folks that I work with.
When you were talking about making everything work to spend more time with your daughter, and I'm thinking, oh, how lucky me and my wife were that we lived in the same building as my
Mhm.
in-laws. My wife stayed with her son for the first 2 years, and how unique that is. And you
Yeah.
would wish that had been the case, as in more leave for parents. And I know there are efforts in various areas in the nation, but it seems there's still a lot of work to be done. That time, pivotal time in the beginning, yes, the child doesn't really remember, but I think there are probably some detrimental effects of parents not having spent those initial formative years.
It is interesting and like the attachment between parent and child is so critical. Not just for mothers and also for fathers. You're a dad. So I think it's something that in the US we have a lot more to figure out on how we can help support that more. It was this amazing gift that my husband's company gave him. He had more paid time off than I did, which take that for what it is. But it really then gave them the space to get to like him to really get to learn all of the routines and those types of things that a lot of dads in particular don't really think get to have that space otherwise, at least in the US. The other piece that I think is happening more in the US is that the like median or average age that people are starting to have children, particularly women, is rising a bit. That's something definitely on the East Coast and New York City. You see that very normal. In the Midwest, it's still folks have children younger, but even, when I think of like when my parents or my grandparents started having children, they were significantly younger than I was. And there is something I think that's very different about that because I knew what my life was like as an established professional already by the time I had my daughter. So there is still that space for like like I was describing, like I missed my craft. When you become a parent, there's so much you don't know, and you're reminded of it like so often, right? Every day. So sometimes I found myself craving, like, oh, it'd be nice to, have a day or 2 days. Not in those first several months. Those I really was just fully exhausted and getting my bearings. And but come 6 months, I knew like, oh, this like I do still miss some of that professional thing. So I think, being able to offer folks in the US and just wherever more of a blend of like taking that time you really need, particularly also as the person who's birthing a child, like your own body healing if you're breastfeeding, like time to do that. Yes, through that exhausted period because you're not producing the same quality of work when you're just not sleeping or you're waking up every 2 hours. Um but then being able to, like, for someone like me, like, I wanted to gradually start to dip my toes back in. I have a dear friend who, she decided she's taking a year and a half off after she had a child, and I was talking to her now that her infant is, like, 8 months old, and she was like, "Yeah, I'm, like, kind of starting to get the itch to do something again." Um and I think that can be really normal for folks who already have that career and are feeling more established and know kind of what life is like versus potentially someone who's younger and isn't kind of in that phase of life yet necessarily. They may really like that whole year break.
Sounds like later on, of course, you will go back to work, team environment. But what are the moments right now that justify doing the clinical practice, despite how difficult it is, the many hats that you're wearing?
Yeah, I mean, I think one thing is just like when for whatever reason, right, we don't have childcare for a day. Like there was just a snowstorm or my nanny's ill or my daughter's sick. Like I have a lot more flexibility. It's not like I'm counting days, right? Of like, oh, I only have X amount of days off, so I can't use that. Or it provides just amazing flexibility for that space to be able to like get to step in as mom. It means I'm not earning any money that day, likely, right? Or that I'm not able to do, something my partner and I have tried to work out is if something happens with childcare, making sure I can still have my sessions, but kind of the rest of my day gets scrapped. And uh, that's something that I would not have been able to do if I was, in a hospital, in a larger hospital system, likely, and definitely not like in person at a job. It would have likely been just the whole day. Then I couldn't go in. And I'm fully remote right now. My practice is still fully virtual, and it's nice to be able to, when I'm slogging through something, I still do some research. Like after reading research papers for a couple hours, to like go and steal a snuggle from my daughter and like kind of
I
reset.
guess I guess all of that makes it worthwhile. So
Yeah.
if you had to explain, let's say to somebody who's thinking of psychology potentially as their field of work, if you had to explain what the difference between the freedom that a practice
Mm.
brings, but also the pressure.
Yeah. I would say that launching a private practice, if you are not someone who is naturally kind of inclined to sell yourself, um, and you don't have some significant financial reserves, is pretty tricky without a partner who has a stable income. I've had friends who've done it and they've been totally successful. And it's something that if I didn't have those things set up, I would not have felt comfortable making this pivot at this time. Like if I were had done this before I was married or um, earlier, I just don't think I would have felt comfortable doing it. Networking is not something that I love. I'll be honest. So, but for folks who do, I have a colleague who's amazing at it. So she shifted to private practice. She was full within like her first 3 months, and it was incredible. Um, so it just depends kind of on the person and how connected you are within like your community and your field, and how much you enjoy that and can readily do it.
That's very interesting. You've added another layer to, I guess, to any profession. You would think social media, it makes it easier to put yourself out there. You have to have that extra layer of marketing, of selling yourself, as you mentioned. And I know individuals who are in the teaching field who are doing on the side, tutoring, and you have to put yourself out there. So you have to pull clients to yourself by putting yourself out there. They want to grow. Now, uh, I want to transition to go back to the time when you were formulating kind of or in the early stages of becoming a psychologist. And from a previous conversation, of course, this wasn't the first profession that you considered.
Yeah, yeah. So when I went to college, and all my application essays and everything were about wanting to go into political science and major in pre-law, and I really wanted to be a politician. I was very into politics. Um, really was like passionate about the government, and thought that being a lawyer would really be a great pathway into that. And the idea, yeah, of getting to like uphold the law through the court system was really interesting to me. Once I got to college, I didn't, both my parents had gone to college and actually had graduate degrees as well, but they didn't do a ton on, like my mom was a teacher and she said, don't go into teaching. My dad was an educational psychologist, and he worked for a company that actually they did like educational videos that you'd watch in school. So it was psychology, but it was nothing like what people think of when they think of psychology. Um, but they didn't necessarily provide like a map of stuff. And I had always been a good student, so I said what I wanted to do, and my mom said great, and my dad told me he didn't think I'd make a good lawyer or politician because I was too honest. Um, so I got to campus and I was taking classes and everyone was taking psych, so I took psych and I actually really liked the teacher, and um, I just kind of thought like okay, I guess I'll do this instead. And then I just went with it, kind of fell into it.
I like that. It's by the way, at some point in college, I was a triple major. I graduated with a degree in English, media studies, and I actually declared a political science major because I also loved, I didn't think I was going to be a politician. I simply just loved the classes. I think I had a great professor. I did not graduate with three majors. I just did a minor political science. For anyone, at the least, I guess you can end up with a profession, accountant. And the other end of it, the positive is college begins to ask you questions, gives you ideas, the way to think about things, and that's growth. And that's, I guess, how it was for me. Like, but you discovered something else. What were those specific things do you remember that caught your interest?
So, what I'd say is I ended up not even taking a law class. I'm looking back on it, I'm trying to remember why. I don't know why I never did. But I did. I liked the intro to psych course. I thought it was interesting. Um, and I think something else that for me was really uh, attractive was the fact that I knew I could go on this path, and there was a bunch of different types of psychology, but I knew that then I would have a career path, right? So like if you major in accounting, you're going to be an accountant. I didn't like math, so I wasn't going to do that. But I've always been someone who was a little bit, I think, struggled with some of the abstract ideas of application and was a little unsure of what that would look like. So it was like if I do pre-law, then I go to law school and I'm a lawyer. And it was okay if I do psychology, then I go to grad school for psychology and then I'm a psychologist. So it gave me a path that I think was really helpful and essentially like a scaffold. I double majored in psychology and women's studies, and I really liked the women's studies piece, but that was something that I was like, okay, this is so interesting and theoretical, and there isn't a job. I'm not going to be a women's studyist. Right? Like there wasn't something I could see directly at the end of that. And with psychologists, I could specialize then in treating women. And actually earlier on in my career, I was able to work with pregnant women who are struggling with addiction. So like, I, I liked that idea of, okay, if I do this, then I can line up, get my ducks in a row, and I know what the ducks are that I'm looking for. So I knew I was going to have to go on to more school, but I liked school. It wasn't a deterrent for me. It was still a clear path and something that was interesting. It also, the undergraduate institution I went to was a large research institution. It was University of Wisconsin. So I was able to get involved in a lab right away too. I learned about that and then applied to labs and then was doing research and thought that was like really interesting. I didn't like the research I was doing. It was looking at affect in twins and children. and I didn't like the fact that I had to do things to, like, pull out certain emotions, and some of them were upsetting, but, um, I liked that idea of, like, being able to contribute to the greater good and knowledge of our society.
Very interesting. I want to go back slightly to psychology when you made that choice. I took intro to psychology. This would be probably close to 20 years ago. And I remembered studying the brain and very, I guess, the biological physiology aspects. And now, in more mature years, I can't help but have this thought, wow, I feel like if somebody told me what comes later, maybe I would have persevered. Now, I'm thinking of these things that we don't know if we would have started earlier, if we ever considered a pathway. Maybe we would have liked it, but we never simply discovered something because we didn't have the support system. But what's there beyond the horizon, beyond the introduction, that might pique someone's interest if only they knew what psychology is like down the road?
Hmm, yeah. Um, I think for like, for being a clinical psychologist in particular, right? I think part of it is, like, what are someone's, like, values, right? And if you value doing something, like, in service, right, of someone else, because as a psychologist, that is realistically, it's a helping profession, but it's helping in a way that is a bit muddier than, like, being a primary care doc or a surgeon, where you're still relying on information that the patient's giving you. But in psychology, it's a bit more of a puzzle, and you're kind of sitting next to the patient, figuring out the puzzle, and the pieces are becoming clearer as you spend more time with them, and you listen more, and you ask questions that turn over other puzzle pieces, and you're starting to get this picture that then enables you to help them. And I think if you can think of psychology as that, it's kind of this mystery that's slowly unraveled in this partnership that you're creating with your patient. um, it's not that you get to fix everything. It's not that you always get the outcome you want. A lot of times it's just helping someone live a life that is the least impairing, right? Depending on what disorders you treat. Um, if that's attractive, then I think psychology can be a great path. If it's not, then psychology is not the path.
I love the way that you explained it. If you want to just have a problem X, here's the solution. This is how we operate to fix it. If you're not looking for non-linear work,
Hmm.
something that's this might be for you, something to consider, but you have to get beyond that, those aspects of education earlier on that you have to kind of just plow through. So
Yeah.
I love that puzzle piece example. What was that specifically about, that specific concentration, even within the field of psychology itself, that drew you to addiction?
Yeah. So it again was kind of an accident for me getting into addiction. In undergrad, you're not necessarily like specializing in what you're going to focus on long term. So, like I said, the research lab that I was in was children. For some people, they find it right away, and that's amazing. I wasn't one of those people. Um, so I was interviewing for master's programs. I will say caveat. I initially interviewed for PsyD programs. No one had explained to me the landscape. I applied to two. I got an interview at one. I was only 20 years old. No one should have accepted me anyways. That's way too young to get into a doctoral program of any kind. I didn't get in, and then thought, okay, I'm gonna take this year off. I finished school early anyway, and a year early. So I'm gonna, give myself a beat and then apply to master's programs initially. So when I interviewed in master's programs, um, I thought I really wanted to study schizophrenia. I actually have extended family members who struggle with schizophrenia, and it was, a term I learned in a psych course was me search, right? It was that idea of like learning more about something that applies to me or is directly related to my life. And the program that I interviewed, or one of the programs that I interviewed with, the person that I ended up working with when I was there, she was the director, and a long term mentor for me, Dr. Liz Katz. She's an incredible psychologist. She said, "Well, we don't have anyone who's doing schizophrenia research right now, but I do have some data on addiction. And we had this interesting conversation as part of the interview about addiction. And I was like, yeah, I could totally do addiction work. This is also really interesting. And had family ties to that as well. So it felt really relevant. And as soon as I started working in that, I got my first placement, which was across two programs. One was a general outpatient clinic for substance use disorder treatment, and the other one was for pregnant women who were opioid dependent. I just fell in love with it. It was like, oh, this is it. I have found my people and what I want to do, and what feels like incredibly meaningful to me.
What is that meaningful? Because you mentioned me search. Did I get that term correctly?
Yeah, yeah,
Yeah, I love that. I actually wrote it down just because I found in talent acquisition, you talk to people, and a lot of individuals, you see the pattern. Like, why do you want to do this job? Why are you applying? And they'll say frequently enough to pick up a pattern. Oh, I've had family member. I myself went through this. So no, now I have a name for it. But
yes.
to go back, like, what was that? Like, oh, this is it.
Yeah, I had done the research with children, and while it was interesting and everyone has emotions, it just didn't like spark for me this deep interest and engagement. I was doing my hours because I had to do my hours for credit. But once I started to do this work, I found myself really wanting to do the work. When I was still doing research, it was feeling really driven and feeling really compassionate for the folks I was working with, and like really believing that like this was critical to do to help advance the field of addiction treatment. And in the clinical side of things, you're for folks struggling with substance use disorders, they're often really stigmatized. My initial populations that I worked with were also uninsured individuals, some of them homeless. And coming into my office and having, even though I was really green and I cringe sometimes to think about my skill at that time, um, it it was maybe one of the only times they were getting someone who truly wanted to help them, who was just sitting there listening.
So what is it that the layperson doesn't understand about addiction? And just to context, I'm was born in USSR, Soviet countries. There you can say stereotypes about drinking, and yes, from what I can remember, it's part of the normal life in terms of if you work, for example, you at somebody's house installing something, you're fixing, you're a plumber, you get paid because for the company or the state pays you, but they might just give you a bottle of alcohol as an example, or give you just a little shot. And that's looking at it now, retrospectively, on how certain how alcohol permeates a culture, you can't help but have certain thoughts. I think everyone, large part, adult, understands addiction, the word itself, but once you're there learning about it beyond the superficial, you're getting into, I guess, the why, not just the how, the underlying. What was that like? What were those initial discoveries, maybe those aha moments for you?
I think some of it was figuring out that like I didn't get to want it more than want change more than the person in front of me. I had I remember I worked with a client who was actually around the same age as me, and they were working to get their GED, and they had done classes, they did all this prep. The first day went well, and the GED exam was across 2 days, which we won't get into why I think that's so awful and sets people up. But he just didn't go back for the second day, and, like, I was so heartbroken. Even thinking about it now, I was just like, this was gonna be the thing that was gonna get you on this path to get you to, whatever it was you wanted to do, and I realized he wasn't ready for that kind of change or those next steps in that moment, and I needed to check what I wanted for him and think about where he was and what he wanted at that time. He's a patient that I still think about sometimes, even though it's been, I don't know, 18 years since I worked with him. Um, so there's that space, I think, in needing to um, recognize that my first mentor had told me, like, their successes are theirs, and so are their failures and their missteps. and not taking responsibility for that was really challenging initially. And it's still, I still sit with a lot of difficult stuff and get consultation from friends when or colleagues rather when stuff pops up that I need it. Um, but I think that's one of the interesting things about psychology. A lot of people that are drawn to psychology like want to help people, they want to fix stuff, and that's really you. There's the help part is real, but you really don't get to fix stuff. That's really for other people to do. You're there to help them on that journey of recovery and change. And that I think has been one of the really tricky parts for me. That's really humbled me.
Thank you for sharing. Yeah, it must be frustrating if you want to help people, but you are not allowed to do the work for them. I guess like I think about counseling in terms of career counseling that I have an interest in, how it explained to me by a professional before. It's not about giving the answers. It's about just talking and letting the person figure out for themselves. So I see a little bit of correlation there. It's not about telling me, oh, you should do this job if I'm a college student. It's about asking questions and providing, let's say, experiential experiences. And it seems here, you shouldn't try to solve the issue for the person. You have to basically discover things for yourself. No one can help you and no one may. Reminded me of that for some reason. But I've also read that addiction is masking another issue. What is all of that about?
I don't think anyone is misusing substances to a degree that it's actually causing impairment in functioning, in relationships, in health without something else going on, right? Because why would you mask? Why would you want that altered state so much that it's actually causing problems for you if there wasn't something else going on? Depending on the study, rates vary like wildly for co-occurring disorders from like 30 up to 80% for individuals with substance use disorders. I have had very few folks that I've worked with that don't have a co-occurring mental health issue. There is definitely, like we were talking about, societal norms where people don't even think of something as problematic. I grew up in the Midwest. I'm from the state of Wisconsin, which also is some of the highest drinking rates and consumption problems in the US. So not quite the same as Eastern Europe. And it's part of the culture. It's what, when you were talking about someone coming over, I thought like, oh yeah, I think my mom would do that when I was a kid. She's like, oh, do you want a drink? We've got whatever. And it's so funny to me because I think like I would never offer someone an alcoholic beverage who was in my home to help with something now for a variety of reasons. But so you have also these family systems, neighborhoods, communities, culture where using is so normal that people don't. It doesn't even cross into your mind that it's a problem, and the negative consequences that it might have. People don't even associate with that, right? It's kind of like for someone who's maybe like a heavy smoking back in the day. Obviously, there were problems related to it, but no one really saw them as problems. Related to nicotine, cough, having phlegm, being sick for longer, any of those types of things. And now we look at that, we see it all, right? And we recognize it and we can say like, these are actually consequences of this behavior. So I think there's a huge connection there. And when it comes to change for recovery, I think one of the things people often get wrong is that you're not going to treatment once and like getting cured and then it's done. It's just not like that. It's something that's long term. It's something that's chronic. It can be in remission. I liken it to cancer, right? And there's stuff we can do that we know can help decrease the likelihood that it's going to come back. But long-term recovery from severe substance use disorders, it takes time and it takes a major overhaul of life and relationships. It's the people that you're around, right? If someone stops using and wants to make all this change, but their partner still uses, people in their home use, all their friends still use, they're not going to be able to make that change.
So how do you persevere in what sounds like just like such an insurmountable undertaking? I don't mean to sound kind of grandiose. It's just that it requires such a drastic change of what a person is used to, and the person wants to help, but they have so many factors, personal, family members, society. How do you work through all of that? What keeps you going with each for each client, knowing that you can't quite do the work for them, but also realizing that you have to reconcile this with the monumental change that they have to implement?
A big part of it is making sure that they've got a team, right? That I'm not the only person. I might be the only person to start when someone's working toward acknowledging that a change is indicated, but making sure that depending on the substance use disorder, we have some fabulous medications that can be really helpful in reducing use or helping people maintain abstinence. So getting that on board. I worked with someone who was a master brewer once. They had to taste beer every day at work. That was literally part of their job, and they struggled with a severe alcohol use disorder, and it was in a residential setting. The first few weeks, they were like, "Oh, how am I gonna do this when I go back?" And the rest of the team was all like, "Go back? What?" And then they got to the place where they're like, "I can't do this. I need a career pivot, and I need to do this quickly because I'm not gonna be able to perform this job in the same way, um, or perform this job at all." So, I think it takes a lot of patience on the part of the providers and the team, and I do think it takes a team approach. Part of what happens when it comes to addiction broadly is, and I say this meaning not just substances, but gambling, um, sex addiction, gaming, phones, all of this, is that we stop having these like meaningful connections and emotional intimacy with people, and we start to put that onto whatever it is, right? For in substances, it's like instead of going to talk to someone at the end of a hard day, I'm going to have a drink. Instead of trying to use sleep strategies to go to bed at night, I'm going to have a drink or drink enough that I just pass out. Instead, I feel really happy. I had this good thing happen. I want to celebrate with a drink. And instead of having the connection that starts to happen, and there's that breakdown of a network of people that we need. We're social animals. We need those people. So part of the healing isn't just working with a psychologist or a therapist, and maybe a med manager or a psychiatrist, but it's also having people that you can be real with that get to see you for who you are. And that's why there's so many self-help or mutual help groups that are out there. It's not just 12-step and AA, but there's Smart Recovery, there's Recovery Dharma, which is more Buddhist based. There's women's groups, there's Life Ring. There's so many things now because people recognize like we really need each other.
Okay. Well, it's great to hear that there are a lot of resources. I'm glad you brought this insight about interactions with clients isn't necessarily one-on-one. And I think would be great for someone who is even considering this field to hear. Can you give an example, and I would say positive and a negative, when it worked out well towards the betterment of the client, where you had to get involved, I would assume family members and friends for the support system, and maybe like share a worthwhile example where for whatever reason it wasn't conducive to recovery? Would you be able to do that?
Yeah, yeah. So I actually work with families. I'm trained in an approach to help family members because family members in the thick of it are generally also really struggling. They need their own help because their loved one is addicted to a substance and the family member is essentially kind of addicted to them, trying to help them. So the loved one is obsessed with thinking about using, the family member is obsessed with thinking about their family member and how are they okay? What are they doing? The control that happens around trying to control substance use. The loved one, the family member is usually trying to control, right? Like, how can I prevent them from use? How can I make sure the substances they're using are safe? And all of these things, it just becomes really maddening for them as well. So they need to look at what am I doing that's not working? What can I change? And how can I take care of me? And processing their own hurt and sometimes just traumatic experiences with all of this. So I think it can be really important for family to get their own help. There's also family support groups as well. And the gamut, similar to the like 12-step and Smart Recovery ones, they have family versions too. Um, and then uh if and when it's appropriate, also doing couples and family work. with I think there's a distinction here of doing it on your own and also doing it with your loved one in the room. There's also approaches like craft and invitation to change that help people um, specifically learn a little bit more about what they're doing that they think is helpful. And maybe it is helpful, maybe it's not helpful. And then learning some new skills that we know can be really effective at supporting their loved one in their own recovery. Um, there's also space for like couples therapy and family therapy too, sometimes in the context of recovery, as well as their own like self help and mutual help groups. And models I've seen. Um, so I've run family groups before, and I've seen some family members who have had like really incredible outcomes. It's slow. And I always remind them, like, this is not overnight change. You're working on your change. They're working on their change. So I've supported one family in being able to get their loved one connected with treatment and back independent, and it was such an awesome case to work with. Um, and I worked with another patient who I tried to get their family members involved, and the family members they weren't interested. They they were frustrated that their loved one wasn't better, that they did treatment and they should have been fixed. They were disappointed and mad at me for that, for not fixing them. They also didn't want to engage in treatment themselves because they had the belief that this was not their problem. This was their loved one's problem. And if they just fixed it, then everything would be fine. Unfortunately for that family, that individual then had more relapses. They struggled a little bit more because they weren't really getting that support at home, and they were working so hard and making so much change, and the family dynamics weren't changing. And those dynamics created a lot of distress for them and rejection, which then served as triggers for them to go back and continue to use.
It just sounds like it takes that saying, it takes a village, it takes a family, a support system to really make it happen. It's applicable here. Like, I love patterns. I look at things, there's interconnectedness between various ways of life. So when you look at your career with the clients that you consider successes and maybe not failures, but learning experiences, learning moments. So what are these patterns in a general sense that you're seeing would be worthwhile somebody starting out in this field to hear?
Yeah, that's a good question. I think, some of the patterns around like taking on too much, that can be it's really easy to do as a mental health practitioner. And it leads to burnout really quickly. So be it in an institution, working, in the field of substance use, um, just a lot of it's a higher risk population generally, and like being really mindful of your own boundaries and your threshold. It's okay to not feel comfortable working with someone and to let someone know that. So I think, if you're not saying no ever, you're putting too much on your plate and you're taking on a variety of clients that feel it's good to have a challenge, but if you're not sure that you actually can like help someone because you don't have the expertise and there might be someone who's a better fit, I think being really mindful of that. In another capacity, I serve on a board for certification, and we'd asked someone like, what are some clients that you aren't comfortable working with? And they said, well, nobody. And I just thought, how is that possible? Um, are you a good provider for everyone? Like, I don't think I'm a good provider for every person. So it was just kind of striking. So I think that's a red flag to look for when you start to think that you can see everyone, you can always take on more. It's just not realistic, and it shows up in the work. You're more distracted in a session. You're not providing the same tier of care that you can provide when, it's kind of like quality over quantity, making sure that you're focusing more on that, not just for your patients, but also for your own self. Burnout's really high in mental health. You have to take care of yourself.
I've spoken to a number of individuals in the mental health field in this term, the vicarious trauma.
hmm
How were there moments when you experienced it, and what have you learned from that?
I don't, I don't, um, I don't necessarily believe that I've experienced vicarious trauma. I've definitely worked with, I worked in the Veterans Affairs system, so I've heard a lot of horrific things, and definitely have like sought supervision and peer consultation after some of those things, and worked with some high risk patients who are in really difficult spots. And I think for me, it's more. It can be like compassion fatigue and starting to recognize when I'm taking on too much of what's happening for a patient, right? We want to have empathy, and when that empathy becomes so overwhelming that now I'm feeling like I'm really living their experience, that to me is a red flag of I need to take a step back. I need to look at like what's happening for me. I need supervision around this case. Assuming it's one case in particular. Um, it's important to have some of those emotional boundaries as a clinician. It doesn't mean you don't get to be real. I've definitely cried with patients before, in the moment, and then processed, just shared with them a bit what was coming up for me, and then processed it afterwards of like, whoa, what happened there? What is it about this relationship that's so close for me?
Right. You mentioned supervision, mentioned mentorship. What role does it play in this field?
It's critical. I Obviously, in your training, you need a ton. I was really fortunate at the University of Tennessee. We had an incredible supervision program. You had peer supervision, so other students. I had like 7 hours of supervision every week. My first year of seeing patients, which is rare. And I am so thankful for it because it helped me really be able to like dissect what I was doing. I didn't always love it that year. Um, but the other thing I think that can be a misnomer is like supervision doesn't end. And maybe it's not traditional supervision, maybe it moves more toward peer consultation, but it's still really important to have that because one day you go from being a unlicensed professional to a licensed professional. And for whatever reason in our field, we have said the time when then these requirements just don't exist anymore. And it's so strange because it's just, processing of documents. So I believe that ongoing supervision and consultation really makes a good clinician. It helps you check yourself. It helps you get input and feedback from other people on what you might be missing, blind spots you might have, um, and is never going to be a bad thing if you're continuing to see patients.
So now, as we're looking towards the future, now with a private practice, 5 months in, you've definitely built something on your terms. But as you juggle the work with clients, family, and running the private practice, a business, what is still some of the things you're figuring out? What is that something that you still feel you want to or need to learn?
I definitely want to. Um, I mean, I have not explored the like physical space arena of having a private practice like that. So that's something that is still very much, the murky unknown for me. But I still want to also learn a bit more about and challenge myself in how I like market myself. I've gone through professional channels of connecting with other folks and building my network. And marketing in psychology is a little it's different than other fields. There's kind of some ethical considerations that aren't necessarily there in the same way, as if you have like a lawn care business, because of the type of work that it is. So I want to learn more about that and feel really apprehensive about it. Um, yeah, just making sure that I'm doing things that align with best practices, but also with my own level of comfort and what feels authentic to me. Um, the other important piece is, just carving out more time for that consultation. I have an hour a week right now, which makes sense given the number of clients that I'm seeing, and it's something that I still want more of, um, and that I crave. And something else that I've also always done is simultaneous like research with my clinical work, and it's different in private practice. So I want to figure out what that could look like if I'm going to be doing this in the long haul. And also just integrating other pieces. I was supervising at the last institution that I was at. I want to be able to give back to the field and do supervision. getting some of those other pieces integrated. That's the cool part about being a psychologist. You teach, you do research, you do clinical work, you supervise, you get to wear all these hats. And I really do enjoy the diversity of professional roles.
But would there be a thing that you think right now that would make you consider staying in private practice?
I mean, the flexibility piece, like once my daughter's older, I do think, and I have the capacity obviously to be working more. I'd like to work more. But the flexibility piece is probably something that will give me some pause. Like I don't, part of me wonders, like, am I ever going to work full time in an institution again? Or is it always going to be, little kind of bite-sized pieces in different places? Because that might be a better fit for me in the.
Yeah. Flexibility, that freedom, certain level is really, really a big one. But now, looking at the field of psychology at large, specific to what you do you think there's anything in the field of addiction or trauma space that needs to change, whether it's structural or cultural?
Definitely. I think the quality of addiction care that's out there really ranges. I think that needs to be addressed. I think we need more accessible evidence-based care for people that just, when you're in a large city, you have access to that a lot more readily. And even then, it depends on the city. But once you're outside of a city, it's a lot more difficult to access. And insurance reimbursement rates are usually not great. So a lot of places that do provide amazing care, it's not covered. Recovery housing, like sober living, or halfway housing, three-quarters housing, that kind of stuff, that's never covered. We know that's really helpful for a lot of people. So we need to reevaluate what this looks like if we actually want to support people with long-term change. Um, there isn't one ingredient. We know that when it comes to recovery from substance use issues. So we have to be able to offer the myriad of services to help people holistically make changes so that they can get into long-term remission from a substance use disorder, because right now um, we really only offer that to people who have means. And it doesn't mean that some people can't get there. They can, but man, is that an uphill battle. And it sets people up to fail in a way that I just think is unhelpful.
It's hopefully this could be the platform, a way to get this message across. Like I've recently spoken to creative art therapists, and this is an issue that's not specific to this field, but other mental health fields as well. So this just shows there's work to be done. So if something at least that we can do to spread this message further, to connect with more individuals that can identify themselves from the professional standpoint or a client perspective, hopefully this will push this a little bit further. Now, if your daughter ever asked you, why do you do this work? What do you think you would say?
I think I would say that I do this work because um, it's important work, and it it gives me a sense of meaning, and like I'm helping people, right? I'm not representing someone legally like I thought I would do a long time ago. But instead, I'm getting to help them deal with really difficult stuff that they might not feel comfortable talking about or sharing with other people. And I'm really lucky that I get to be a safe harbor for that work.
Thank you. Thank you. I love that safe harbor. That's a really great thing to have, especially for some of us who, I guess the plain way to say is lack it, like this kind of a safety. So Sam, thank you so much for this. Thank you for your honesty, your story, and the reminder that behind every clinical title is a person who's still figuring it out. If folks want to connect with you to learn more about your work, where's the best place for them to find you?
Yeah, they can find me on my website at anchorpoint-psych, psych.com. They can send me my emails on there. They can also use the contact me form and reach out that way. I'm happy to chat with folks who are thinking about psychology, thinking about doing addictions work, and just want to hear also maybe about even private practice or anything like that.
Thank you. Thank you so much. I will make sure to include the website anchorpoint-psych.com in the show notes. We'll have the link right there in the show notes. You can click on it and go directly to your website. Thank you so much for being here today. And to those of you listening in, remember, growth doesn't always look clean. It doesn't always look linear. Sometimes pushing yourself means stepping back to protect what matters most. And until next time, continue to push yourself.